Hello and welcome back to video 2 in this series on rotator cuff related shoulder pain. In this video we'll be talking about pain and pain management and managing flare-ups. So, what is pain? Pain is defined as an unpleasant sensory and emotional experience of either actual or potential harm. So you can see there's a few factors within this definition that we have to consider, but most importantly it's not a sign that harm has necessarily occurred to the body, but it can be a sign that your body anticipates that it may be at risk, so it's trying to protect you. And pain that lasts for a short period of time is referred to as acute pain. Occasionally, pain will go on longer than we expect it to. Often, a longer period of time we would define as longer than 3 months, and this is then referred to as chronic pain. So why does chronic pain occur? Well, chronic pain occurs due to changes that occur within your nervous system when pain has persisted for more than 12 weeks. And this is something that we'll explore over the next couple of slides. So how is pain created? Well, this image shows it quite nicely. Pain has often been thought of as a bottom-up approach, with stimulus such as temperature, chemicals, pressure, stimulating your nerves. Your nerves then send signals up to your spine, which further sends them up to your brain. Your brain then processes this information alongside other factors such as your emotions, your previous experiences, and your understanding of the context of the situation you're in. It will then decide whether to trigger a pain response. If it decides it wants to, it will then send the information back down. At this point, it can then decide not to trigger this response. However, it has been recognised that pain is now thought of more as a top-down process, with the brain having the ability to either up or down regulate pain depending on the level of perceived threat. And this is more common when pain has gone on for a longer period of time and has become chronic. So for example, when it receives this information, your brain will then decide whether it's happy with what's going on. If it is, it will make you less likely to experience pain. Or if it's more concerned, it will make you more likely to experience pain. And the longer pain goes on, the more likely it is to have this protective mechanism of making you experience the pain. However, this process is very complex, and more is being learned about it all the time, and it is an ever-changing landscape. Chronic pain is complex, as I just mentioned. And what happens with chronic pain is our nervous system alters how it functions and how it's organised, and it can become influenced by many different factors that contribute to our lives. Part of the nervous system that would usually be linked with how we perform our normal day-to-day activities starts to become reprocessed and starts to become linked with our pain experience. And as a result, when we then perform those normal activities, we may experience pain. It almost becomes a faulty wiring of our nervous system and is a process we refer to as central sensitivity. So what does this mean? Well, the sensitivity of the nervous system changes. It's not a fixed state, and it can be modified using appropriate management strategies, which is part of the reason why you are seeing your physiotherapist. And learning to manage your symptoms can help reduce the impact of shoulder pain on your life. But it's not an overnight fix. This is a process that can take many months of working on it to overcome the symptoms and learn how to manage them and know what to do moving forwards. One of the ways we can help reduce this sensitivity and help improve the management of your shoulder pain is through an approach called cognitive behavioural therapy. This is a talking therapy that helps us to recognise and identify a management plan for your pain. We do this through this model here, the cognitive behavioural model, and you can see there's a few different boxes on this model. If we relate this model to the example of acute shoulder pain, it will help us better understand what we're trying to achieve. So if we take the situation being that you've had an onset of acute shoulder pain, this can lead to thoughts that are negative about the situation. This in turn can lead to anxiety and fear about what it might mean for your ability to perform your daily activities, your hobbies, your life, your work. You might also experience some physical reactions. Your arm or shoulder may feel weaker. You may find you can't do the activities you previously done. You may have reduced movement. And all of these things combined lead to what can often be described as an avoidant behaviour. So you might start avoiding activities. For example, if you know reaching to the top shelf in your cupboard hurts, you're probably less likely to do it. You might even switch to using your other arm. And this process can lead to the development of persistent pain and a vicious cycle of symptoms. The aim is to try and address these factors to help with your symptoms, whether that be by targeting the weakness through exercise, or addressing the thoughts through education, or your moods and your feelings through relaxation and meditation, or improving your understanding of the situation. The idea being, if we target each of these boxes, hopefully we can then reduce that persistent pain, reduce that vicious cycle, and help you get on the road to recovery. One of the strategies we use when trying to manage pain, we refer to as pacing. You may have heard this already described previously. The reason we implement pacing is because of this little diagram over here, this circular chart. Because what people often do is follow a boom-bust cycle. What that essentially means is when you have a good day, we're often eager to remain active, do as much as we can on that period. This leads to us overdoing it. This is the boom. Then what happens, because you've overdone it, you may have a flare-up of your symptoms, which then requires you to rest and recover. This is the bust part of the cycle. You then repeat the process, because when you recover, you then have a good day, so you become eager to become active again. So the aim is to try not to overdo it on this section over here, so that you don't necessarily have as much of a flare or any flare, and then it reduces the period of time needed to recover, which overall will lead to you doing more throughout the week. One of the ways we do that is by a pacing system, and this traffic light system is a nice way of thinking about it. So green activities are viewed as the activities that are the easiest, that are probably unlikely to cause a flare-up. Amber activities that are slightly harder than green, but not quite as intense as red, these may potentially, if you do multiple of them, trigger a pain flare-up. But on their own, as long as they're not too often completed, you may be able to manage them without too much of a flare. Red activities are the more difficult activities. These are the ones that are most likely to cause a flare-up. And one of the ways we can implement a strategy using this to help reduce a flare-up is by trying to plan your activities in advance. So trying not to put multiple red or amber activities next to each other on consecutive days or on consecutive hours throughout the day, and try and space them out throughout the week, while filling the gaps in between those with green activities that you know are relatively safe and not going to cause you too much of a flare-up. So I just mentioned the phrase flare-up. So what is a flare-up? Well, flare-ups are a temporary increase in your pain. What is important to consider with a flare-up is just because it hurts doesn't mean you're causing yourself any harm. It doesn't mean you're making any injuries to your shoulder worse. It just means you've irritated it, almost like poking a bruise. What's often required when you have a flare-up is a short period of relative rest. And what I mean when I say relative rest is not going and lying in bed for 2 weeks, but just sticking to general, gentle daily activities, trying to avoid any extremes of activity. So for a shoulder, you might avoid going out and playing tennis for a few days, but you might still do your household activities. And then you gradually aim to return to your normal activities over a period of a few days or a few weeks, depending on how your symptoms are. With the long-term aim being that we get you stronger and get your shoulder more able to perform its activities. Utilising the traffic light system that I previously mentioned and the pacing structure to try and help you achieve that. Modifying your sleeping positions to get you more comfortable, to get better sleep and sleep quality as discussed in video 1. Or considering things like relaxation and stress management if your emotions or your mood are potentially contributing to the flare-up in your symptoms. So that's the end of video 2 on rotator cuff related shoulder pain. In video 3 we will look at exercise and the benefits of exercise and explore some exercises you can start doing to get your shoulder moving in the right direction. I hope you'll join me.